Right. I think we should make a start, because these lightning talks, those of you who've attended previously, the whole reason why they succeed is that there is a timing thing where we absolutely will finish at 12:30, and I promise that as chair that will be the case, to allow you to get back to whatever you're doing. So thank you all for joining. This is Newcastle Health Innovation Partners Lightning Talk series, and I'm really delighted that we've got Professors Ruth McGovern and Amy O'Donnell with us today to speak about exploring opportunities and support for social care research, which is an often neglected area, actually, I think, of research. And we're really blessed to have two outstanding researchers in Ruth and Amy. So I'm not going to say anything more. I'm just going to pass over to Amy to kick things off. I think she's passing to Ruth, and then Amy will wrap up at the end. There will be time for questions at the end of their talk. You can either put the questions into the channel and pop something in chat, or you can ask it in real time, and I'll try and keep an eye on the screen for that. So whatever you feel comfortable with. So with that, I'm going to pass you over to Amy.
Thank you, David, and welcome everybody. Great to see so many faces, some familiar faces here. Thank you for joining us on this incredibly miserable day. Myself and Ruth are going to give a little bit of a kind of an introductory talk, really. So to give you a flavour of what we mean when it is we're talking about social care research, because we appreciate some of you will be coming from very different sort of backgrounds and levels of experience in this field. And then Ruth will focus in particular on the kind of increasing opportunities there are for people interested in this area of research nationally and in this region in particular. I think I would very much agree in that it's been a neglected field to date, but I think that is thankfully changing. And, you know, it's great that there's recognition of that within NHIP by having this kind of public health and social care pillar established. So before we see if that's worked, we just really wanted to kind of spend a couple of moments telling everybody a little about ourselves and why it is we're here today talking to you about this particular area of work. So I'm going to hand to Ruth first to do a little bit of a who am I spiel.
Who am I? Good question. Sometimes I know the answer, sometimes I don't. But I am Ruth McGovern. I am currently a senior lecturer in public health research, although David very kindly introduced me as a professor. I haven't recently been promoted to that, and I'll be a professor in public health and social care when that takes effect in August. I have a professional background in social work, and I joined the university quite a few years ago now, around about 15 years ago. From practice, and at that point I joined to work as an alcohol health worker on other people's research trials, and I was doing a PhD at the time, and did that because I really wanted to be in a research environment and to really be able to develop some research skills. But in order to become part of a research team, I had to leave practice and take what was really quite a secure permanent role that was doing quite well in, progressing quite nicely, and start a new journey on a new pathway in order to transition into research. And I'm really pleased to say that is no longer the case. That's not what you have to do now to progress from social care into research. And I'd be delighted to share with you some of those opportunities during our presentation today. But my research is very much focused around children's social care, looking at both the adult and the child within that particular context, the adult being a parent in that situation, and have a real focus around the development and evaluation of interventions. Amy?
Thanks, Ruth. So I don't come from a social care kind of practitioner background. I am coming at it much more as a kind of broad health services researcher. And my work is all focused around how we can improve care for people with substance use, mental health, poor mental health and other co-occurring complex needs. And I've got a particular interest in kind of how and whether we can use novel models of care, digital technology, integrated care pathways to support that general goal. And inevitably, when we're talking about this population, these kinds of models of care are multi-sectorial. They're not just about kind of traditional health sector, but they very much involve the social care, as well as kind of third sector and sort of peer networks as well. And this is really kind of where my interest comes in how we can make this really kind of complicated care infrastructure work together more successfully to support these individuals who have, you know, some of the worst kind of health and other outcomes in the UK and elsewhere. As I've mentioned, because social care does cover this incredibly broad range of kind of activities, services, organisations, all of which might be involved in providing this kind of support package for the kinds of individuals that I generally work with. We thought it was worth just spending a few moments just making sure that I guess everybody is aware really of quite the kind of the breadth of work that this sector undertakes. So generally we look at it in terms of kind of child and adult social care. As Ruth has mentioned, most of her work is in the kind of the child social care sphere. Most of mine focuses more in kind of adult social care. So when we look at child social care, really, this can involve all kinds of sort of personal care for children and young people who might need extra support in their lives. And this can be relatively low level support. So personal home visits that might kind of keep a young person active, involved in the community, involved in their education, etc. Or it might be higher level, and in some cases that would involve a child or young person being taken into care. For adults, likewise, it really covers an incredible range of sort of support activities. So it can be around providing support to help adults live more independently. It might be kind of more direct personal care, everything from supporting getting up in the morning, washing, dressing, using the toilet. It might be help in carrying out kind of everyday household tasks, cleaning, cooking, eating, shopping, etc. Support with organising sort of physical leisure activities and the like. It may well involve providing respite care or carers breaks. So that's helping people who care for those with sort of, you know, long-term disabilities or other issues and providing them with a break from that they so desperately often need. And it might also involve support in helping people identify appropriate housing if they're affected by homelessness. So it's really kind of cradle to grave, a whole range of kind of very varied and very complicated care support. And given this broad scope, when we think about kind of who works in social care, I think it's also important to highlight when we're thinking about, you know, what kind of research we undertake and which kind of social care practitioners might be involved in this sort of career pathway, that it covers an enormous range of carers. This figure is taken from a King's Fund sort of piece of research that looked at the adult social care sector. And it really highlights the kind of the scale and complexity of the workforce there. It's actually in total bigger than the NHS, the social care workforce. So in 21-22, adult social care alone covered almost 18,000 different organisations, across almost 40,000 different care providing locations. And around 1.5 million involved in care provision. And I think when we think of social care providers, we often immediately think of kind of social workers as being kind of social care professionals. And yes, this workforce does include these kind of registered professionals, from social workers, occupational therapists, people working in managerial and supervisory roles. But I think it's also important to recognise that the vast majority of people in our social care workforce that work in kind of care, sort of in the care sector on a paid basis at least, are care workers themselves. That's well over 1 million people, and they deliver direct care in home care agencies, directly in people's homes, in care homes, etc. And of course, beyond that, there is a vast army of unpaid carers who are very much part of this kind of overarching infrastructure. That's, you know, families, friends, spouses, who provide the kinds of everyday support for sort of vulnerable adults and young people that we've described here today. So it's a large and complicated sector, and I think that's kind of reflected in some of the kind of the challenges around the research opportunities available. I'm going to pass now to Ruth, who is going to sort of tell you a bit about what we mean by social care research and some of the opportunities that are available in this area at present.
Thank you, Amy. I think in such a complex area with so many different people delivering social care, so many different populations potentially benefiting or receiving social care, and so many different multifaceted aspects to that, it's really quite difficult to know what social care research is. And I'm delighted to see Claire Egan on the call, my colleague from the Clinical Research Network, because she and I did our best to try and map that out and to develop a definition based upon some NIHR documents that had also tried to do some similar things, to try and give a clear sense to people about what we mean when we talk about social care research. And we took that also to the Social Care Research Special Interest Group, which we established through the Applied Research Collaboration in the North East North Cumbria. And there's a group of colleagues from both practice and also research who've got an interest in social care that come together to meet to talk about social care research and social care problems. And we took this definition to them, and they helped us evolve it a little bit further. And this is what we're resulting in. And I think really one of the key things about the challenges with defining social care research is it's almost easier to say what it's not than what it is. And what it isn't is healthcare research done in a social care setting. But we do expect that there will be a range of different activities that are done with a range of different people in a range of different settings, which are set out here for you, for hopefully for your information, useful information. But one thing that I would definitely say to you is the thing about social care research that makes it social care research, given that complexity that Amy set out, is whether it has a social care outcome. So really thinking about what difference the research makes for the people who use social care services, the carers of the people who use social care services, or the people that provide social care services, is really the key to defining social care research. Amy? And in that space, if you accept that there is a definition that we can more or less largely agree on, which is social care research, there are a growing number of opportunities for research funding. I'm listing just NIHR here. There are, of course, other funders that do really important research in this space. But the key programs that I want to draw your attention to within social care research, in addition to the School for Social Care Research, which is also funded by NIHR, are these two programs, and that's the NIHR Research Programme for Social Care and NIHR Health and Social Care Service Delivery. And these are two programs that have regular calls available for people who are interested in answering some important social care research problems. The NIHR Research Programme for Social Care is new. It's currently got its second call out. Its first call is about to go to stage 2. This is a biannual research-led call, which is available to early career researchers right the way up to very experienced social care researchers. It welcomes applications from a wide range of methods, all around responding to the key social care research problems. It has a substantial budget. It replaces the research for social care, which used to be part of research for patient benefit. And that particular funding call was great because it was one of the first of its kind to be a researcher-led funding call. It was initially only for adult social care. It later got extended to children's social care as well. But the funding was capped, similar to research for patient benefit, was capped at 350,000 maximum per study. So it did restrict the kind of methods you could use and the kind of research you could respond to. But this, as I said, this has got the much wider scope and also includes children's social care within this particular programme. I'm a member of that funding panel and we'll be very happy to chat with anybody who've got any ideas about projects they'd like to submit to that particular funding committee. The NHIP Health and Social Care Service Delivery similarly does researcher-led calls, but also includes commission calls. It has the full range of project size and durations that is usual for each SDR, and it really has a focus upon organisation of care rather than effectiveness here. But in addition to these programmes that I've set out here, all of the NIHR programmes include social care research now within the commission calls. I'm aware of HTA having recent commission calls out around adult social care and children's social care. So it really is a very exciting time to be involved in social care research. Amy? And really a key part of the social care research landscape, of course, is fellowships. It's a key interest for the NHIP as well to support colleagues who are interested in applying for and being successful in these fellowships. And again, there's a couple of fellowships I'd really like to draw your attention to here that are available for those colleagues who are interested in pursuing research careers and need support to really develop the skills or enhance different career opportunities. We've got the NIHR Clinical and Practitioner Academic Fellowship, which is a familiar fellowship. It's been offered through NIHR for quite some time. I guess the difference here is the move from health settings and allied health professionals to now include social care practitioners or people within the voluntary and community sector. We've already heard from Amy that this is a very diverse workforce. So if somebody works within the voluntary and community sector and provides services commissioned, then on behalf of social care, then that would be eligible for these particular fellowships, as they would also for the local authority fellowships in the moment. And they go right the way from the pre-doctoral stage through doctoral to advanced clinical fellowships. And we see a similar sort of trajectory, range of different opportunities that are available through the NIHR local authority fellowships. So these are very specifically targeted, not to social care, but to those colleagues that are working within a local authority setting. The Spark placements are slightly different from the clinical practitioner and academic fellowships insofar as you're looking at between 6 and 12 months worth of a fellowship opportunity where colleagues can come along for 1 day a week, 20% of the time, and just be exposed to that research opportunity. Similarly, the pre-doc goes a little bit further along those lines and has within it some training opportunities through master's programs, or really some protected time to apply for your doctoral fellowships that are also available, and then obviously the DLAF and the ALAFs to progress further. But I guess one of the problems with these, whilst it was really exciting when these social care fellowships began to be available and invite colleagues to apply for, one of the things that was a real challenge for colleagues within social care was to be competitive for these fellowships alongside, particularly for the clinical and practitioner academic fellowship, was how could you compete with colleagues within health who maybe are more embedded within research cultures and maybe research is part of what they do or part of the opportunities that are available to them. How could you develop the knowledge, the skills, the experience, but also the CV that's necessary to really help those colleagues be successful on those highly competitive academic fellowships? Hear me? So one of the things we've been doing an awful lot more in the North East and North Cumbria is really trying to build capacity in order to build capacity. And there's a few different schemes that I wanted to highlight to you that have been ongoing in the North East North Cumbria, and some of which will continue, we hope, to be available to colleagues that are wishing to embark upon a research career. So we have the Clinical Research Network Social Care Research Ambassador Scheme, which I'm very happy to say I was involved in the initial pilots, and we've been working with Claire Aiken and other colleagues within the CRN specifically around that. We're currently on our third cohort of the Social Care Research Ambassador Scheme. It started its life in 2020, so you can imagine that was a little bit bumpy, but we've just appointed 10 social care colleagues to that ambassador scheme. Each will be doing 20% of the time. We'll be really involved in some quite intensive training packages and some opportunities for some hands-on research. We've got the ARC, Social Care Research Fellows, and again, I was very happy to see Abizola Balogun join the call, a colleague of mine who was successful in that particular call that went out. We appointed 6 Social Care Research Fellows to that through the ARC, from varying whole-time equivalents from 20% up to 100% role for a period of between 1 and 2 years, and that has been part funded by the Research Support Service, who contributed a substantial amount of funding through their services. I'll not dwell too much on each of those individual schemes because we need to allow some time for questioning. I'm mindful we're running out of that. But these schemes are all about giving people exposure to research, giving people training for research, and giving people hands-on experience of doing research in experienced social care research teams. I'm going to hand back now to Amy, who's going to finish off with what we can do. Amy, you're on mute.
Rookie error. Hopefully that's given you a bit of a flavour of both what we mean by kind of social care as well as the opportunities that are currently available in this area. And I just wanted to remind you that for those of you who are interested in sort of social care research careers, that NHIP can provide a range of support. I won't go into these different areas in detail here today, but clearly if any of these could benefit you, do get in touch with our NHIP colleagues. However, myself, Ruth and Sarah Sowden, we're the kind of co-leads of the public health and social care pillar for NHIP. We're also very happy to kind of, receive any expressions of interest, or if you just want advice, guidance, tips and tricks, do please get in touch. And I think that is everything really we wanted to say today. We're very happy now to take any questions. I don't know if there's been anything in the chat, or use the hand function, and I shall stop sharing.
Thanks, Amy, and thank you, Ruth. That's brilliant. Really nice overview, actually, because let's be honest, I suspect there may be a few converts on the call who knew about these areas, but there may well be a number who did not. And I would have to include myself in not knowing some of those tranches of funding. I mean, I think some really key points that I'm taking from that is that NIHR, obviously they still call themselves NIHR, don't they? But it's National Institute for Health and Care Research now, which I think the clue's in the name. So that's really important. And I had it actually as a kind of priming question lined up to ask you, did you know how much they've spent on social care research? And you've put it in your slides. So they're really keen to do that. And we're keen to take their money off them. So it's a case of trying to build capacity, isn't it? And try and get colleagues enthused with this. Because the way I look at it is, if you follow it out to the logical extreme, making an intervention, particularly maybe earlier on in life or in the early years into teens, in the setting of social care, probably will reap such amazing benefits downstream. It's got to be, no wonder that's where they're wanting to put more money. You know, because ultimately hospitals can't cope with everything that's being thrown at them. So interventions upstream, right into social care, is incredibly logical. So you don't want to hear me out for the last few minutes. So let's have a few questions. Either pop a hand up or pop a message into the chat. I will just put a plug in there for the Academic Health Science Centre Academy, which Amy and Ruth were very kind to reference, and obviously a key in that. So the NHIP Academy has had an amazing success record in terms of getting colleagues through, both from personal perspective in terms of programs, external fellowships, and so on. They're drawing on an immense pool of expertise now, and this Amy Brown is your kind of go-to contact there if you didn't want to go direct to either Amy or Ruth. Amy is very aware of a lot of the schemes coming through, and obviously the director of the academy is Dave Jones, who's not on the call just here. So I see Amy nodding away there. We've got Amy on the call, so we're really keen to help Ruth and Amy grow capacity. So whilst I've been chatting, as an occupational therapist in oh, fantastic. I was down your neck of the woods on Monday at Teesside Uni, looking into a business case for an OT to work in public health, working with plus size individuals. We're not there yet, but would like to do some formal research into this area in future. I don't know if it's a kind of a comment, perhaps more so than a question, but I don't know if you want to come in on that, Amy, or maybe that might be more well, either of you, Amy or Ruth.
I'm quite happy to maybe jump in and then see if Amy wants to add anything in. I think one of the things that occurs to me is some of what we've discussed today is about how we support colleagues to become social care researchers. But I think there's an awful lot to be said to health colleagues considering the relevance of their research to social care, or to work with social care to consider the relevance of that to the outcomes of the patients that they support. And I think for a long time we've done a lot of research criticising practice about being in silos. It's kind of ironic that we're finding ourselves in a situation that we're now saying, oh no, that's not social care research, go over there to health, do that for health. I think we really need to be doing, you know, multidisciplinary, multi-sector, multi-professional research where it's the patient or the service user, whatever you call them, in the middle, in the heart of it, whose outcomes are getting improved by whoever, funded by however. I hope that responds a little bit maybe to Helena's comment in the chat. Not Helena, sorry, the OT from Middlesbrough.
Amanda, yeah, I think it's Amanda Sparrow.
It
yeah,
is,
no,
yes.
That's great. And do get in touch, Amanda, offline if you want to pick up on that and get plugged in a bit. Oh yeah, so Helena's got a hand up, and we're going to give you the last question, Helena, because I promised that we'll finish on time. So over you go.
Thank you, that's kind. Thank you, Amy and Ruth. I'm Helena. I am a social work and social care practitioner with an interest in research, and I briefly participated in some research that Abisola led, actually, which was reaching into children's social care. Ruth, I was really interested to hear your experience at the start of your career, coming from social work and making that jump. And I just wondered if you've got any 2 top tips for social care and social work practitioners who are wanting to make a way into research when they haven't been doing that for some time in their career.
I think all of my tips would be the things that we've highlighted today. Get involved in the different schemes that are available. Consider the fellowships and the support of NHIP. But before all of that, the building capacity, things like linking in with the likes of Abisola, doing the kind of research that Abisola's doing, learning about it through a slightly different role is really, really helpful. And finally, get in touch with Amy O'Donnell, get in touch with myself. We'll be really happy to chat with you about your specific circumstances and what might help you.
Thank you, I will.
Great, thanks, Helena. No, I think you couldn't wish for more enthusiastic and excellent role models than Amy and Ruth. They really are quite exceptional. And in my experience, really, it's a somewhat unusual setup that we have within NHIP and the university with regard to covering out this area of research. So if anybody on the call, not just Helen, is interested, please do get in touch. I know that both Amy and Ruth would really interested in speaking with you. So look, it just drawn to a close now. I mean, it's been really great to hear from you both, Amy and Ruth. Very grateful for your time and putting the presentation together. Obviously, this aspect of research is really important for the Academic Health Science Centre, Newcastle Health Innovation Partners, and really look forward to seeing more great things from you in future. Thanks to you all who've taken the time to join us for half an hour, and look forward to seeing you at the next Lightning Talk. So look out for comms out from NHIP in due course. All right, enjoy the rest of your lunch break. Bye for now. Bye-bye.